So I will be answering the first question, which is why our group chose the articles that we did and how what we found can be applied to current professional practice. So we decided to focus on the medical benefits of marijuana and why it should be decriminalized for those purposes. So we were looking for articles that showed the different benefits and how it can help benefit people with different disorders. And we were actually able to find 4 articles, all that show the therapeutic benefits of marijuana. Most of them focused on the use for chronic pain, especially fibromyalgia and rheumatic disorders. The use for neuropathic pain as well. But there are other benefits, including reducing nausea and increasing appetite, specifically for those patients undergoing chemotherapy. It's also been shown to be effective in reducing anxiety and for treatment of glaucoma. Now, as nurses, we are very well aware of the opioid crisis that's going on in this country, and we want to help advocate for our patients to help them find the best treatment possible without going through the addiction that opioids can cause and have been known to cause. One of the studies that we found showed that chronic pain affects 116 million Americans and costs the country $600 billion in treatments and lost productivity. So with the articles that we found, we were able to come to the conclusion that marijuana is a much better and safer alternative than the use of opioids and has much fewer side effects. Although there is much more research that needs to be done on the side effects and the use of marijuana, especially how much, how often, we believe that it's a much better and safer alternative than other FDA-approved treatments that are out there right now.
So we actually chose 4 articles, and in the first article called Therapeutic Benefits of Cannabis, a Patient Survey, the study actually found that cannabis is safe and effective for people with chronic pain. The patients who participated in the survey, their average pain score was a 7.8 before treatment, and then after treatment, it was a 2.8 after treatment with cannabis. So that showed a remarkable improvement. The research is very promising, and the pain relief implications, especially with those people with chronic pain, is encouraging. With more research, we feel that marijuana can be useful in helping reduce the opioid crisis in this country. And in nursing today, we feel like we have a responsibility to promote comfort and healing. Now, in the outcome of the second one, called Community Nurses Support for Patients with Fibromyalgia Who Use Marijuana to Manage Pain, the outcome was almost identical. The results showed that people with fibromyalgia could use marijuana to manage their pain and alleviate the symptoms, and it basically helped improve their quality of life. The article also showed that combining marijuana with smaller doses of opioids, it actually created an opioid-sparing effect. This shows that using marijuana can drastically reduce the amount of opioids one would have to use to basically achieve the same level of pain relief. In current practice, this means that the use of lower doses of opioids can actually or potentially reduce the opioid abuse, addiction, and adverse effects. In the article, Cannabis Therapy in Patients with Rheumatoid Disease, the outcomes were encouraging for people with rheumatoid inflammatory and neurological disease processes. The study showed that on top of pain reduction, it actually helped with reducing spasticity in patients with MS. It helped achieve better sleep quality. It also helped reduce inflammation and helps reduce the progression of neuropathy, which actually helps people with diabetes. The study states that approximately 15% of people with MS or other rheumatoid diseases actually use marijuana illegally for symptom control. Imagine how many people would use it and benefit from it if it were legal. The last article that we chose was called Cannabinoids in Pain Treatment and Overview. The study found that due to long-standing negative connotations for marijuana use, its availability is really limited. But as people get educated and about the benefits of it, we as healthcare providers are slowly removing that biased framework. The study called for nurses to continue to play a fundamental role in research, in ethical practice, and in policy. So we need to do this so that we can, ultimately serve our patients in the best way possible.
Nurses in different healthcare settings such as pain management, palliative care, primary care, and those who work with patients who would consider using cannabis should be encouraged to learn more about the topic through continuing education programs that are outcome oriented. And some of the topics would be mechanisms of endogenous cannabinoid systems, its interactions, side effects, and the safe dose determination. This would help eliminate myths and misconceptions about the use of cannabis, and also the knowledge and the skills that nurses would gain would also improve patient outcomes in management of pain. Nurses have a powerful voice to create policy and to affect public opinion about the use of cannabis, and also to help eliminate policies that are currently restricting access to beneficial studies of cannabis products. Restrictive policies at federal, state, and payer levels must not hinder clinical judgment in pain management. Also, policies are needed to support research that is focused on long-term effectiveness of cannabinoid use, on the discovery of additional cannabinoids for pharmaceutical and medicine use, and methods to reduce addiction potential of not only cannabis but other addictive central nervous system drugs. When working with patients with fibromyalgia who use cannabis, community nurses can adopt this approach by being non-judgmental on their use. Nurses can discuss on how its use can be embedded in the patient's use, their benefits, and consider how harms can be reduced. Nurses should advocate for further unbiased research, and also for patients to be able to receive marijuana safely so that they won't have to expose themselves to the dangers of the black market.
Marijuana is considered a Schedule I drug on the Controlled Substance Act. This creates legal barriers because only 36 states have legalized marijuana for medical purposes. According to the article Cannabinoids in Pain Treatment, marijuana or scheduling marijuana at the highest level of restriction causes legal and practical barriers because they're unable to obtain sufficient product to conduct safety and efficacy trials. This means that it's going to hinder the ability to obtain further accurate research. And we need this research in order to understand the true benefits that's going to be available for our patients. And we do this by having unbiased research and education. I mention unbiased research because marijuana holds such a stigma in our public right now because people have used it for as a drug to get high off of. But we need to remember that marijuana has been used for hundreds of years by different tribes, by many different cultures, as a healing herb. And so ways we can overcome these barriers is going to be to become active members in our community, to advocate for marijuana use, so that our patients can have a safe method of obtaining this marijuana, and so that they can reap from these benefits. And we can do this by talking to different policymakers and push for legal change Also, we can join advocate organizations such as the American Cannabis Nurses Association, which they have a website where they put out educational resources and information so that people can better understand marijuana for medical use. And so we just want to give our patients an alternative to narcotic pain medication. Also, currently Texas is passing or trying to pass House Bill 1365, which expands the Compassionate Use Act, and that's going to just expand for people with more illnesses. And so what we can do now is understand that marijuana use for medical purposes is the benefits of it will greatly outweigh any potential risk that is associated with marijuana use.
So our group decided to be pro-marijuana use in the medical aspect. We did come across a study done by the University of Hawaii that basically their patients who used marijuana as a form of pain management for either chronic or acute pain had added benefits. Not only did their pain significantly decrease, they also came across the fact that their patients had a decrease in anorexia, which would help promote, eating. So then they obtained that added benefit of increased nutrition and being able just to enjoy their quality of life a little more. They also said that they had discovered that besides that decrease in anorexia, they found an increase in mood, meaning that their depression was a lot less than they had previously seen in the patients. They also had an increase in concentration and focus, even though a lot of people don't think that marijuana would help with that. These studies helped those patients who would constantly think about chronic pain to think now that they could do other things because they weren't just constantly going around that pain management that they needed because now they had temporary relief. They also happened to discover that they would help their patients kind of get over the stigma that's behind the use of marijuana and be more accepting towards it and use it as this alternative therapy to chronic use of opioids. And they understood that the benefits that they obtained from marijuana were much more than from their use of opioids. So they saw a significant decline in opioid use, more use, so their pain was better managed with marijuana. And basically one of the things that the Hawaii Association also said was, look, we understand that it's very frowned upon, but there has never been a case discovered of the use of marijuana where somebody would be either, they haven't found an overdose, and they haven't even found a lethal dose for the use of marijuana. So that's why they supported the use, and that's why we feel like at least we deserve a fair, unbiased study regarding marijuana use for chronic and acute pain in patients.